Comportamental, o GEEC. Só avisando que o encontro será gravado, a gravação será disponibilizada no canal do YouTube do grupo, e o encontro será conduzido em inglês por conta do nosso convidado mais do que especial. So, good afternoon, everyone. My name is Flora. I'm the organizer of the Behavioral Economics Study Group. Now that we've gone international, we might start calling it the Brazilian Behavioral Economics Study Group. We see a lot of new faces here today, so thank you so much for joining us, and I suppose it's due to our really special guest. Today's theme will be about FIST and THUGS, Nudge in 2020. About over a decade of Nudge, we've seen a lot about its potential, implications, and limitations, and today we'll be able to hear from the very own author of Nudge himself, Professor Cass Sunstein. Professor Sunstein is the professor of law at Harvard University from 2009 to 2012. He was the administrator of the White House Office of Information and Regulatory Affairs. He's the founder and director of the Programa of Behavioral Economics and Public Policy from Harvard Law School. And he's the co-author of Nudge along with Richard Thaler. And Professor, personally, you're my biggest academic and inspiration and role model. So thank you so much for joining us today. I think a year ago when we were discussing your articles in the group, we would never have imagined that we would almost have the chance to meet you in person and have you here today to discuss this with you. So I just would like to highlight how important it is to build in an ecosystem of behavioral science in Brazil. And I think we're all aware of the impact that behavioral science can have on building a better society. So thank you so much for being here today. And without any further comments, the word is yours. Thanks.
Thank you so much, Flora, for the kind words and for the invitation. I'm sorry I'm speaking in this terrible language, English. My Portuguese is very bad, so you're going to have to bear with English. It's a thrill to speak to you, partly because there's so much opportunity in Brazil to use behavioral science and nudging for good, and I've had some interaction with people in Brazil on this topic, and because nudging is really like a young child who's not a baby anymore, not just crying and asking for food, able to do some things, but really we're all right now in a process of helping nudging and behavioral science to work and to be better and to help people. I'm right now engaged with the World Health Organization on behavioral science and public health, and there are 20 or so people on the group from 16 countries, and to see the World Health Organization working on behavioral science to deal with COVID-19, to deal with smoking, to deal with sexual and reproductive health, to deal with an assortment of problems that faced all over the world is completely inspiring. Okay, so I'm sure you all are aware that the basic idea of nudge is that you can have gentle interventions that maintain freedom of choice, but that steer people in a particular direction. There's evidence, for example, that if patients are sent text messages telling them they better take their medicine every morning, or that they have a doctor's appointment next Thursday, that can be very effective in promoting better health outcomes. We know that a GPS device is a nudge, and the reason it's a beautiful nudge, a GPS device, is that it allows individuals to specify where they want to go. So if you want to go to a particular street, it's your decision. And it's also the case that the driver is allowed to say the directions that are set by the GPS are not the driver's preferred route. The driver would like to go someplace prettier or someplace that reminds them of their childhood or something. So it is respectful of individual liberty, a GPS device, and that's a goal of nudging, that they increase navigability. Most of the time, people want to be in better health, and if they are given clarity about social distancing or wearing a mask, then that can be effectively like a GPS. What we've learned over the last 10 years and more is there's a simple framework, which I'm about to describe, which can organize much of behavioral findings. And we're going to call it FEAST, F-E-A-S-T. And the basic idea is if you want behavior to change, you should focus on each of those letters. The first letter in the FEAST framework is fun. And the idea is if you want people to eat healthy, or if you want them to do something that is in their educational or economic interest, to make it fun is a very good idea. If people learn that eating, let's say, vegetables is good for them, they will be more likely to eat vegetables. But if they learn that the vegetables are delicious and really taste good, the data suggests that that's more effective. In New Zealand, the Prime Minister has made good use of the F part of the FEAST framework, saying in very difficult circumstances in New Zealand, we're going to have to be pretty closed down for a while. But the Easter Bunny and the Tooth Fairy have exemptions from the restrictions. The Easter Bunny is allowed to travel, and so is the Tooth Fairy. That made people feel under difficult circumstances that life had humor and wit in it, not despair and fear. And to do that with respect to things that are large or small is often a very effective strategy for behavior change. The E in the FEAST framework is the most important, I think. And the E refers to easy. If you want to change behavior, the best thing to do often is just to make it easy for people to do the relevant thing. If people aren't, for example, driving safely, if they are endangering themselves and others, either to redesign the road or to redesign the car so it's easy for them is an extremely effective nudge. In Sweden, there's an effort called Vision Zero, meaning no one will die on the roads. And the Swedish authorities are very alert to the E in the FEAST framework. They're trying to make it very easy for drivers to avoid causing accidents. The A in the FEAST framework is attractive. And the basic idea here is if you have an intervention that is ugly or dispiriting, makes people's spirits fall, often they'll block their ears, they won't tune out. If you make it attractive and vivid and colorful, often it will have a big impact. Calorie labels are one way to combat obesity. Just make sure there are calorie labels when you go to the restaurant. And they can be effective, but a traffic light system, red, yellow, and green, can be more effective. That green color is attractive, and using attractiveness as an impetus for behavior change is often very smart. The E wins the Olympic gold medal in the FEAST framework. The Olympic silver medal is won by the S for social. And the basic idea here is people are very much affected by their perception of what other people are doing. And if you want people to engage in certain behavior, to give them clarity that most people are doing that can be extremely effective. So where I live in Massachusetts, at an early stage, it was very clear most people were wearing masks. Not at the very earliest stage, but a very early stage. And if you went to the grocery store, or if you went to the drugstore, and you weren't wearing a mask, this is a time where there was no legal requirement that you wear a mask, you felt like you were violating the social norm because it was visible that most people were wearing the mask. And I can tell you can see in real time when people started being alert to the growth of a majority norm in favor of mask wearing, and pretty soon everyone was wearing a mask. Now that's just one example. You can think of any number of behaviors. You can think of sex discrimination. You can think of sexual violence. You can think of any behavior of any kind at all. As the understanding of the majority norm shifts, then that can become a self-fulfilling prophecy. With respect to the S in social, there's some exciting behavioral research which Thaler and I did not know about when we did nudge, which suggests that often if the majority norm isn't the right one, this may involve environmentally good behavior. It may involve behavior with respect to, let's say, honesty. If people learn that there's a new or emerging norm in favor of sustainability or in favor of honesty, then people will be more likely to act in accordance with what they've learned is the emerging. Now, I find that very exciting research because it shows a tool that can be used in circumstances in which the majority norm isn't the right one. So if the majority isn't doing the healthy thing or the safe thing or the just thing, if you can say honestly that people are increasingly engaging in certain behavior, that can be very powerful. One reason I think is that people don't want to be on the wrong side of history. Another reason is people think if people are increasingly doing something, then that's a signal it's the right thing to do. Okay, the last word in the feast framework is timely, T for timely. And here the basic idea is that if you nudge people at the wrong time, it may have no impact at all. If you educate, let's say, high school students about how to plan for their retirement, that's probably not the right time to educate them. They probably won't care and they'll forget. But if you educate people who are in the midst of planning, let's say their retirement, let's say they're 40 years old or 60 years old or even 25 years old, but they're doing something that's retirement related, that's when you should educate them. If you tell people something with respect to road safety at a time when people aren't driving, they may forget. If you tell them at the time when they are driving and about to go over, let's say, a dangerous area, that's a very good thing. Okay, that's the feast framework. There is an evil sibling to the feast framework, and let's call it THUGS, T-H-U-G-S. This is the framework which some people are using online right now as a way of nudging people to lose their money, and where some people are using it in a way to create a kind of terrible GPS, which will lead people to a route which will not get them to their preferred destination. And think of the THUGS framework, which I'm about to explain, as a way of either stopping people from changing their behavior or instead inclining them to change their behavior in a very bad way. The T for THUGS is terrible. So instead of fun, make it horrifying, terrible. So if you try to get people to engage in certain, let's say, healthy or safe behavior, and they say, that's terrible, I'll hate that, then they won't do it. And unfortunately, some governments right now with respect to COVID-19 are making people feel scared or hopeless. It's terrible. And then they don't do it. The H in the THUGS framework is hard. So if you are trying to get people to engage in behavior that's very complicated or time-consuming or expensive or especially confusing, they won't do it, even if it's very much in their interest. And often public officials and lawyers, I used to be a public official, I still am a lawyer, often public officials and lawyers aren't as attentive as they should be to the importance of H, hard, in deterring behavior or discouraging it. The U in THUGS is ugly. If you have a behavioral intervention that's ugly, people will not look at it because it's ugly. People don't want to look at things that are ugly. If something is grim, the G in THUGS, as opposed to social, if it induces a sense that this is something that most people aren't doing, that I would be unique in doing, that I would be looked down upon for doing, that I would be criticized for doing, then the likelihood that I will do it is reduced. The S in the THUGS framework is for slow. where if people are given a behavioral indication which is slow to absorb, or which takes effect slowly, or which isn't at the right time, then it might be useless. Okay, this is a little abstract. I'm now going to go to a concrete problem that I confess I am very much focused on now, which is vaccine hesitancy. And I'd love it if you think of vaccine hesitancy as not only urgently important right now for its own sake, but also an example of a behavioral change problem for which nudging or some kind of improved choice architecture might be a really good idea. Okay, the question is, what do we know about vaccine hesitancy, both from behavioral science in general and from work on vaccine hesitancy in particular, that could help us cope with probably the largest vaccination effort, maybe in the history of the human species, which is coming soon. Okay, I'm going to give you some tentative ideas. The first behavioral idea is that when we observe vaccine hesitancy, it's often a problem of one thing, just one, unfavorable architecture. If there is an architecture where people can't easily find the place where they're supposed to get vaccinated, if it's time-consuming to get there, if it involves forms and administrative burdens, if it's hard to get vaccinated, then we will see much less vaccination than we would otherwise see. In the behavioral work on vaccination in particular, the word often used is convenience. That's a good word. I prefer the word architecture because it's a little bit broader than convenience. They're both good. But think of this as emphasizing the E in the feast framework and suggesting if we want to overcome vaccine hesitancy, to provide a highly favorable architecture for vaccination in Brazil, in Germany, in Denmark, in the United States, in Mexico, is job number one. It's urgent. Right now, where I live, getting a flu vaccine is so easy. It's everywhere, the flu vaccine. It's around the corner. Once you visit me, I can take you there. Guess how much it costs? Nothing. Guess how much time it takes? Approximately 5 minutes. Guess how friendly the people are who do it? Very friendly. It is costless, fast, and respectful. If there's something like that, we will have a behaviorally informed intervention, which will help overcome vaccine hesitancy. And that is a clue to a lot of social problems. The second of the three factors for vaccine hesitancy, where the first is architecture, is social influences. And here the basic idea is that even if it's very easy to get vaccinated, if your neighbor and friends are telling you, don't do it, you will get no help, you will just get sick, it doesn't work, and it has terrible side effects, then you might not do it. So we need to think hard about social influences, particularly in communities where the social influences are likely to be an obstacle to vaccination. We also know how to overcome social influences. And the S in social already tells you, if there is an emerging practice of getting vaccinated, if people are learning that, then the social influences will suddenly become favorable. If there are people in the community who are particularly credible, they are trusted, and they are known to have the same identity as the people who would otherwise be hesitant. So they're part of the same demographic group, same religion maybe, same ethnicity, then those people can be highly influential advocates of a different kind of social influence that's favorable to vaccination. So we know one behavioral challenge is a lack of good architecture. We know the response. We know another behavioral challenge is unfavorable norms. We know the response. A third is individual beliefs. And if individual beliefs are frightened or suspicious, then the interventions that are nudges could take the form of information that's presented attractively and in a timely manner. It could take the form of something that's very easy to absorb. And best of all, if it's not exactly fun, getting vaccinated isn't always fun, it can at least be not terrible. And that can work on individual beliefs. Okay, so for some examples of uses of a framework like this that have been very inspiring, in many parts of the world, anti-poverty programs, whether it involves educational opportunity or food or money, have taken the form of just making it really easy, with people sometimes just directly qualifying for a benefit rather than having to apply in the first instance. Calorie labels mix success, but when they've been successful, it's that they're presented at exactly the right time when people are ordering food. Many leaders in many countries over the past months have introduced the F in the feast framework by making various health protective steps kind of fun. Okay, what we've learned in the last 10 years, and I think this is an improvement over nudge, is we've learned a great deal about human behavior, even more than we knew in 2008 and 2007. We know that the most important organizing idea for, I think, policy efforts is human beings have limited attention, that the number of things that we can think about in a minute or a day is limited. And when people need a nudge, it's often because their attention hasn't been focused on something that matters. And when people are benefiting from a nudge, it's often that people are focused directly on something they hadn't previously been focused on. So limited attention is the king, I think, of departures from perfect rationality. We know also that inertia is an immensely powerful human force, and that people will often procrastinate or not change their behavior. And if we can overcome inertia to get them to do something, we will often have nudged them successfully. We know finally that people show present bias, as it's called, meaning today and tomorrow really matter. The future is often a foreign country, and we're not sure we're ever going to visit. Call it laterland. And since laterland is very distant, it might be on a continent that doesn't even have a name. We need to find ways to make problems, climate change as an example, more salient to people, such that they are focused on the long term, not the short term. I'm going to tell you about one problem by way of conclusion, a new frontier for behavioral intervention, and I'm hoping this will spark reforms in Brazil, just as I'm seeing initial reforms in the United States and the United Nations, actually, that are affected by this idea. The basic idea is that human beings are surrounded by sludge. Think of sludge as administrative burdens, paperwork requirements, waiting time, form filling requirements, which often are devastating to people who are trying to get healthcare, a job, a visa, a permit, or a license. That all over the world, the level of sludge that exists is much higher than the level of sludge that should exist. In my country, a recent analysis shows that the number of hours of paperwork burdens imposed on the American people is 11 billion. Pause over that number if you would. 11 billion hours of paperwork burdens. That's imposed on students, on people of low income, on nurses, on doctors, on people in all walks of life. One reason sludge is so terrible is that human beings have limited time and attention. Remember, limited attention. And if they face sludge, they'll just give up. So they won't get something to which they are entitled. They won't even try to apply something that might improve their lives. For many programs, the take-up rate is between 40 and 60%, and we could easily make the take-up rate 100% by making it automatic or making it very simple. But the problem of sludge isn't adequately captured by what I just said. Think for the moment about people who are sick. Maybe they suffer from heart disease. Maybe they suffer from depression. People who are poor, people who are old, people who are really busy. For all of these demographic groups, and the group of people who face sludge is often disproportionately female, for all of these people, the consequence of sludge is much more harmful than you might think. There's a funny tale told in a book on burdens of this kind of an older man about 80 years old who was trying to qualify for benefits to which he was entitled. And he said, 20 years ago, I could have filled out the forms. Now they're asking me to do that? And he said it with some humor and mischief, as well as with exasperation, as if to say, you're kidding. And there are people all over the world who are facing exactly that problem. They're thinking, now you're asking me to do that? The good news, in an era of COVID-19, some countries have had a war on sludge. They've been saying, you don't have to come in for an interview. You don't have to fill out 8 pages of forms. You don't have to wait 3 weeks. You can get it now. But a war on sludge should be a war that we wage every day, not a war that we wage only in the midst of a pandemic. If you put the FEAST framework together with the THUGS framework and see sludge as part of being a thug, then we can fasten on one question. What's the most important thing that members of the human species are blessed to have? What's the thing that each of us engaged in this conversation are most lucky to have? Here's an answer: time. Let's find a way to give fellow members of the human species more of that. Thank you.
Professor, thank you so much for your talk. It was really enlightening. Those 2 frameworks are really helpful to, like in a practical way, to better shape public policies. I work at São Paulo City Hall, and we're all the time like keeping in touch with this frameworks, and it's quite useful to design better interventions based on that. So I'm going to start the Q&A with a question about exactly that, about behavioral insights applications in government. So we've seen that government organizations have developed in a kind of isomorphic way. So most behavioral science units use communication channels and apply the EAST framework into little tweaks, maybe more in the implementation part of the public policy cycle. I would like to know, how do you envision the application of behavioral insights principles or nudge in other parts of the behavioral of the public policy cycle, and whether, for example, a behavioral insight into lawmaking process would be called a nudge?
Okay, great, thank you. So when I was in our government, I worked on behaviorally informed approaches, And hardly any of them involved communications. They were more about architecture. So let me give you some examples. In our program for free school meals for children, it used to be the case that children would have to, and their families would have to sign up. So we changed the law so that our ministries could directly certify, given knowledge that localities had that people were poor. And direct certification, as it's called, is now covering 15 million children. And it's not about communication, they're just automatically in. With respect to credit card usage, there are various practices by companies that are harmful, either because people are automatically enrolled in things that are potentially very expensive, or because they are not given clarity about late fees and overuse fees. So what we did was we banned some of the practices through law, and we said that with respect to late fees and overuse fees, you have to be very transparent. And that law, to my surprise, is saving consumers $11 billion every year on balance, and the disproportionate beneficiaries are people with poor credit ratings, so that they're really gaining as a result of that. One thing we did with respect to travel in the days when there were travel is we created a program called Global Entry. So if there's probably something like this in Brazil, I hope there is, such that you can apply for a program, and then if you're coming back into your country, or if you're flying within your country, the security is much faster. And it's a program that really speeds everything up. You don't have to do the normal things. It's basically a sludge reduction. We had a very aggressive effort when I was there at reducing paperwork. It wasn't nearly aggressive enough, but it took paperwork requirements away from truck drivers and hospitals. And that is saving people a lot of trouble. And in some cases, it's improving, at least in the healthcare domain, health outcomes. With respect to greenhouse gases and climate change, there's a communications policy is one thing, but if every time people buy a car, they see something that's very clear about greenhouse gases, what we did wasn't perfect by any means, but it was better than what preceded it. I hope if there's a Biden administration, it will be better still. So these are ideas that basically use the feast framework in lawmaking.
Thank you.
There's a question from the chat. I guess it's from Lenise. She asked about what are the criteria you use to, you have to look upon to choose between mandates or nudges. You'll talk about this in the Brisk report we wrote. And I would add to that a question about, well, there were some criticism that you addressed as well in your 2016 book, I guess, The Ethics of Influence, about nudging being some kind of intervention that infantilizes people, that treat them as children. And I know you respond to that, and there's a specific chapter about mandates where you say that, as long as I remember, as I can recall, well, mandates, they are infantilizing people because then they don't have any choice. So if you could address those two questions, the criteria over when mandates are preferable, and when are nudges infantilizing people or not?
Okay, great. Thank you for that. So let's take the infantilizing first. It's good, isn't it, to make progress on that question, to be very concrete about what the nudge is. So if, let's say at a ministry, they want to save paper and they shift from default single-sided to default double-sided, is that infantilizing people? I don't think so. It's just changing the architecture so that you save money. If people are seeing on people are buying a refrigerator and there's something that, sorry, my dog just barked. My dog very much liked your question. If there's something on on a refrigerator that tells you about fuel economy, so that you can know if you're going to save money with this very fuel efficient refrigerator. Is that infantilizing people? No, it's informing them. If people are allergic, let's say, to peanuts or shellfish, and there's a warning on certain foods that this has them, is that infantilizing people? I don't think so. It's informing people. If people are automatically enrolled in, let's say, a healthcare plan on the ground that it's suitable to most people, so long as they're given clarity that they can opt out, doesn't seem like it is. So I struggle, maybe you can have an example, but I struggle to think of any nudge that's been used by any country that's infantilizing. I can't think of one. They are either educative or they are architectural. And I mean, maybe if you're given a reminder every hour that you have a doctor's appointment next week, that's a little infantilizing. You might think, I got it. I got it the first time. A mandate, if people are banned from, let's say, smoking, as opposed to informed about the risks of smoking, we can see the argument that's infantilizing, that someone who's an adult should be allowed to choose whether to smoke or not. And whether or not that's true, the ban would have an infantilizing quality, possibly, whereas informing people about the health risks wouldn't. And you can see this for all sorts of health things. I'll tell you, when I was in our government, there was a lot of concern about sunscreen and whether it would protect against cancer. And some do, depending on their composition, some don't. And some people were interested in banning the ones that help you get a good tan, but don't help you not get cancer. And they wanted to do something very aggressive with that. My view, for better or for worse, was just inform people that this won't help you with cancer. And it would have been, I think, infantilizing to forbid it. To inform people wouldn't be. On mandates versus bans, it's a big question. If people's behavior is just affecting themselves, the presumption should be in favor of a nudge rather than a prohibition. So here I'm following John Stuart Mill. So if you're deciding, you really like chocolate and you're going to eat a lot of chocolate this week, or beer is something you very much enjoy, and you understand that getting drunk might be a problem, but to ban beer and to ban chocolate, that would be disrespectful to individual autonomy. On the other hand, if people are engaging behavior that hurts others, if they're the gasoline they use in their car is causing air pollution that's hurting others, then to have something in response, maybe it's a tax, maybe it's a regulation, is justified on a different principle, which is you're hurting others. So one kind of way into the mandate versus nudge is are third parties at risk. It might be, even in a case of a mandate, you want to have a nudge to make the mandate work. So people might be prohibited from doing things like hurting other people, but also nudge not to do it. So you might have both. A mandate, I say, should be explored in terms of its costs and benefits. So not everybody hears celestial music when they hear the words cost and benefit. It's not as if they feel God's presence when they hear the words cost and benefits. But I really like cost-benefit analysis as a way of thinking about whether a mandate is justified. So if you have a mandate that would save 500 lives and not cost a lot of money, and if the nudge equivalent would save 2 lives and cost no money, the mandate looks better. So to think about what has the highest excess of benefits over costs is helpful.
Hi, Professor. I have a question regarding habit changes. We have seen that nudges are effective to change one-off decisions, such as applying for a retirement plan. Nevertheless, some decisions we may many times, like driving, speeding, or things like that. So how do you see that we can use nudge to change habits?
It's a fantastic question. And so we would need to know what nudge we're exploring. So if people are automatically enrolled, let's say, in a plan of some kind, then typically they stay in the where they are, and it just lasts for a long time. If you, I don't know if you're in an automatic payment plan. I am, because Thaler told me, my co-author Thaler told me I really should. I'm in automatic payment plans, so my credit card bills are paid automatically. And I did that a long time ago, like 10 years ago, because he told me to when we were doing nudge. And still now I'm in those plans. So automatic enrollment tends to last for a really long time. That's an architectural response, right? The architecture is different. And if I do nothing now, I keep paying my credit card bills, and that lasts. I have a car, Toyota, which nudges me all the time. So that if I'm about to back up and hit something, it goes beep, beep, beep. And if I'm changing lanes without intending to, it'll go beep, beep, beep. And it will make noises that are nudges. If I have a flat tire, it will tell me, it will nudge me, get your tire replaced, even if it's not impairing driving yet. And those are kind of ongoing nudges that are effective. If you are given a nudge, let's say, wear a mask, and you're someone who doesn't really want to wear a mask very much, you might do it that day, but as you say, it might not continue. So nudges with respect to multiple decisions might not work, and you need to get people in the habit. Here's some data that is very informative for that category of nudge. It's about whether people will conserve energy at their home. So you may know, do you know about this, where a company sends a letter called a home energy report, which tells people whether they're using more energy than their peers? You know about this. So if people are sent it in 1 month and that's it, it doesn't last. They have to be sent that letter basically for a full year before they get in the habit of doing the things that save energy. And it actually keeps having benefits to send the letter for 2 years. After 2 years, they don't need the letter anymore. But that does suggest that for some informational interventions, habits build slowly. And there might be other things like reminders. So medicine adherence, you know, if someone has some problem such that they should take a pill every day, will they? It might be, it's an empirical question, that you just have to keep nudging them. You have to send them every week a reminder. Or it could be that after you've done it for 6 weeks, they get it. It's like brushing their teeth.
Professor, now we have a question from Luis Drummond, which is about epistemic aspects of nudge. So if people systematically err and fail to achieve their own goals, how could choice architects know people's real preference in order to steer them in the right direction?
It's a great question. The simplest answer is ask them. So if you think of the GPS device, it asks you, where do you want to go? And that's a model. So if a choice architect is a lawyer and you're representing someone who has, you know, maybe they're going to sue, maybe they're going to need planning of some kind, ask them, what are your preferences? And the government is more challenging because it's dealing with a large population, which puts an informational burden on people who work for the government. But often you can learn what the majority wants, or you can learn what diverse population wants and act accordingly. I mean, for many cases, what people want is pretty clear. Like drivers don't want to be dead. That's their preference. They also want to get there quickly. But as between getting there dead and getting there slowly, most people prefer slow. And if they prefer dead, then we have another nudge for them.
Professor, I have another question from the chat from Guilherme. He asks, behavior science as a discipline came under heavy scrutiny after initial responses from the pandemic emergency, being the UK the most prominent case. So in your vision, what's the path that practitioners should take to restore public and policymakers' trust on behavior science?
Okay, great. So in terms of public officials, behavioral science is flourishing right now because of COVID-19. So the World Health Organization is more focused than it's ever been on behavioral science. The director is personally, he just said yesterday on Twitter that this is a priority, and he has an assortment of behavioral scientists working with him. In Australia, behavioral science is at the center of efforts. In New Zealand, there's a flourishing behavioral science community. In Taiwan, which has had significant success as behavioral science is being used to great effect. All over the world, in Canada, behavioral science has really come to the forefront. So among public officials, I think this is a golden era for behavioral science. In terms of the public, I'm very close to the Behavioral Insights team in the UK in general, but on this issue in particular, I don't have clarity about what exactly happened. The idea that herd immunity is the right response is not a behavioral idea. It has no behavioral component at all. I think it's also a terrible idea. I don't believe that the behavioral scientists in the UK were saying herd immunity is what we want. I don't believe that, though I might be wrong. If they were, okay, so my favorite sports team is the Boston Celtics. I want the Boston Celtics to win, but that's not a behavioral science claim. So the claim that we want herd immunity might be a preference. The Boston Celtics happen to be wonderful. Seeking herd immunity happens not to be wonderful. Neither has much to do with behavioral science. I understand that in the UK there was discussion of behavioral fatigue as an issue, which created public concern. In my view, behavioral fatigue is a very poorly understood category. It's not something that behavioral scientists have said much about. So to think of behavioral, and consistent with the earlier question, the opposite of behavioral fatigue is habit formation. And which you're going to get really depends on a lot of knowledge. So I'm hopeful, and I believe that behavioral fatigue was not something that anyone in the Behavioral Insights unit said. So whenever anyone in government is doing something that has bred distrust, the best response is to do something that earns trust.
Perfect, thank you. As we're heading to the end of this meeting, first of all, it would be great to have Boston Celtics playing the Lakers one more time this year, but Miami got in the way, too bad. But as we all know, you're a very prolific author. You leave us always wondering what's next. And this time we know a little bit of what's coming next. So I would like you to talk about Nudge 2.0. I know you and Richard Taylor are working on that. And also Noise, you have a book coming with Danny Kahneman and Oliver Sibony. So if you could talk a little bit about these two books coming up, we are very excited about them.
Okay, thank you, me too. The book with Thaler we've been working very hard on now for about 5 months. And it's been very funny because our original goal was to update the book a little bit and to have some extra chapters, but we've ended up doing much more than we expected, and we fell into, I think, a behavioral trap. Though it's turned out to be fine, but we didn't want to fall into the behavioral trap, and we didn't know we were going to. It's a little like home improvement. where we were thinking of calling it the while we're at it heuristic, meaning you're maybe going to do a little bit in your home, and before you're done, you spend months and a lot of money fixing your home. So we've spent months and no money fixing our book. There's a chapter on sludge that's completely new. We have a lot to say about climate change in the environment, which is new. We have a lot to say about health and insurance choices. That's new. And we have a concept, curation, which has gotten attention in this book, which we hadn't had before. We also have a much more elaborate response to objections than we had in the earlier version. So it's, I think it might be a somewhat smaller house than the other one because we deleted some of the chapters that are now obsolete, but it's a newer house. The doors are freshly painted, and if you go inside, it's sparkling a little bit. The noise book is on a completely new topic, and it's very ambitious. And I give, for the original idea and carrying out of the idea, I give Kahneman a standing ovation. He's in his 80s, and I think it's possible this is the best work of his life, I think. My own view is if he hadn't gotten the Nobel Prize for his work on judgment and decision-making, he would have deserved it for his work on well-being, happiness, and he also deserves it for his work on noise. So the basic idea is that if you go to two doctors and ask them what you should do about a problem, they might disagree, even though they're both really trained. If you go to two lawyers and ask them what they should do, presented with someone who wants to sue, they might say, sue. And the other said, don't sue. If you go to two Social Security disability judges, one might say, of course you get benefits. And the other might say, no, you don't get benefits. If you're convicted of a crime, one judge might say, you are going to be in jail for 3 years, and another might say you're getting probation. So that's noise, variability across people and also within people. One doctor might say on Monday morning, you're going to have surgery. And then to the same person, they might say on Tuesday afternoon, let's just wait, you're going to be fine. Because Monday morning, they're very active and energetic. Tuesday, they're kind of tired. That's within-person noise. And so we think noise is the neglected problem, that bias has a lot of charisma. Bias is like an actor or actress with whom everyone falls in love. Noise is like an actor or actress whom everyone ignores. But sometimes the most ignored person in the movie turns out to be the most important. And that's what the book's about.
Okay, Professor, we just have one last question from Roberta. So she's asking about whether we're going to face a new wave of sludge. So you mentioned that during the pandemic, some countries engaged in a war against sludge regarding like accessing public service. But can you anticipate if we're going to face, for example, things related to corrupt scandal or fake news or things like that, that are related to a different kind of sludge, and how to overcome and respond to those challenges?
It's a great question, and I'm sure we're going to see in some countries sludge. So there might be voting sludge, such that to vote, you have to jump through a bunch of hoops. That's not good. I was told this morning that in some places in my country, you have to wait 11 hours to vote. That's sludge. For allocating resources in a time when there's economic challenges, some officials will use sludge as a rationing device. For visas now, the United States, my understanding is, has always been less good than it should be with respect to student visas. And the reason has been sludge. And the student visa sludge is very high now. I fear that as the world opens up in the coming years, sludge will be used as a kind of barrier. But these are all things we can do something about.
Okay, so with this question, we end our meeting. So thank you so much once more for joining us here today. It was such a pleasure to hear your thoughts. And the meeting will be available on YouTube for those who want to check it again. I definitely will to hear you more calmly. So thank you and have a great day.
Thanks. A great pleasure and inspiration also
Thank
to hear
you.
you all. Thank you.
Obrigada a todos que compareceram, pessoal. Espero que vocês tenham gostado e fiquem à vontade para continuar em contato com o grupo. Temos um grupo do WhatsApp, página no Facebook, LinkedIn. Então, estamos à disposição aí para conversar.
Obrigado a todo mundo pela presença.
Flora. Maravilhoso.
Eu só ia complementar o que a Flora disse também. Desculpa, não deu para fazer a pergunta de todo mundo. A gente ficou tentando selecionar uma ou outra. Até salvei elas aqui, de repente te manda para ele, né? Porque, enfim, a gente estava em cima da hora. Mas valeu todo mundo pela participação.
Obrigado, pessoal. De fato, a gente estourou até 10 minutinhos aí que a gente tinha combinado com ele. Então, peço desculpas, mais uma vez, reforçando o que o César disse, peço desculpas às pessoas que fizeram perguntas que a gente não conseguiu ler, mas a ideia do César é muito boa, a gente pode enviar para eles e ele respondendo, a gente dá um jeito de enviar de volta para vocês, tá bom? Fiquem em contato com o grupo. E obrigado, Flora, pela organização e obrigado a todos pela presença. Bom final de semana a todos.
Valeu, gente, por terem vindo. Beijos.
Valeu, pessoal. Tchau, tchau.
Tá gravando ainda.